Hi, folks. Welcome to the Thinking Slow channel. I'm going to set out in a few minutes why I think subscribing to this channel is going to be a really good idea for you. Let's start with the story of the channel and what it aims to achieve, basically. So, the story of the channel begins in early 2020 when Professor Neil Ferguson came out with his forecast of 510,000 deaths in an unmitigated pandemic. We, along with some other people, thought that was pretty unlikely based on the actual data from Diamond Princess. And although I and the colleagues who are involved in the channel have a maths background, we have no medical background. We could see from a maths point of view it didn't work, basically. So we reached out to a lot of epidemiologists, and we can disclose now that Professor Bhakdi was one of them. There were several others that we can't name at the moment, but they also saw that the assumptions were pretty unlikely to be correct. And we did the normal things of trying to contact people and say, this looks overemphasized. And when Professor Levitt came out, I think maybe before we did, with the same conclusions that this number is overstated by a factor of 8. We thought that the level of, I guess, panic that happened wouldn't happen, but that wasn't the case. We just carried on this track. So we thought, okay, if there's nothing else for it, we will have to get involved in social media and post up our findings. And we've been doing that now for nearly 2 years, basically. And so far, many of the things that we've looked at, starting with the Diamond Princess actual data, have turned out to be more accurate than the official line on many of these issues. So the main reason also that you'd enjoy this channel, I think, is that we have interviews with recognized world experts in their field. So on the left is Professor Fenton, where we started talking about all-cause mortality, which turned out to be a very big subject, and this was a very, very popular video that we did. And also, of course, we talked to Professor Bhakdi very early on in this about vaccines, and I still think today that's one of the most comprehensive analysis you'll ever hear of all of the risks and benefits associated with the vaccines. And I think almost everything that he said, over the last 6 months or 7 months since the interview has turned out to be true. So anyone that listened to that interview would have been massively well informed about vaccines and the issues associated with mass vaccination. So that's a reason to subscribe to this channel, is the interviews with these leading experts. And I mentioned that the Diamond Princess is one of the stories that we broke early, but we also have broken a number of other stories as well. We were early, or I don't think we were first, but we were certainly early with explaining how the statistics on COVID deaths have been, let's say, fudged in creating a new category of deaths involving COVID. We were also quite early in splitting hospital admissions between those that were coming into hospital for COVID with a positive test versus those who were diagnosed when they were already inpatients, so much more likely to be with COVID because they were already in hospital for another reason. We've exposed some what we consider to be dishonest work carried out by the Office of National Statistics that led to a formal complaint, and also we have just recently basically looked at the data of intensive care utilization, where the actual figures don't match in any way the media narrative or the messaging coming from our politicians. So there's a raft of stories there that we were very early on. And obviously, as a subscriber, you would have the benefit of hearing those stories well before they sort of come into the mainstream. And one of the other reasons we set the site up is obviously what's going on with, I guess you can call it now, legacy media. The role, it seems, of questioning government policy is not really happening anymore, and they've just tended to amplify the messaging that's coming from the government, and therefore there's no real very little investigative journalism as we've been used to in the past, of digging into the same data we're digging into and asking questions and testing what the government's saying. That's not the case anymore. So that means that there is a need for channels like this one and others that actually look at data and ask important questions. That's a function that the legacy media is no longer doing, and that is something that we're doing here, basically. The other aspect of what we have is a Twitter account, and it's followed by some pretty important academics and journalists. So you, as a subscriber, would join in this club, and the club includes basically everybody, but it includes some pretty serious individuals who obviously see value in what we're producing, and you would also have access to that value both through the YouTube channel and through a Twitter subscription. So that's basically it. The last point then is that we have roughly about 90, somewhere between 90 and 99% likes on videos. There are very occasional negative comments. I mean, it's literally 1 in 100, and we get a lot of very positive feedback on the site. So, here's an example. Brilliant video. I've shared this and felt so strongly I've alerted the Director of Pandemic Research at ONS. Thank you, Thinking Slow. Looking forward to your next presentation. Thank you for this video. Recent debate such as this is vital in this fight against the corrupt mainstream narrative. So there's many hundreds of comments like that. So that's also a good reason to subscribe. So I think, just wrapping up, basically, you will get access to real analysis that takes quite a lot of time and work, and you will get to identify trends and important issues well before they're covered by the mainstream, many months before. You'll get to hear interviews with world-leading experts. You'll get to join our club of followers, which includes some very serious academics and journalists, and hopefully you will become one of the happy customers that we have already. So please press the subscribe button, and look forward to speaking to you soon. Thanks. Bye.